Before starting hemodialysis, a safe and reliable means of getting access to your blood must be made. The fistula can either be formed on your lower or upper arm, depending on your veins. This usually means having a small operation on your arm to create a fistula. A fistula is an enlarged blood vessel formed by joining an artery and a vein together to increase blood flow. It takes around 2 months to develop to a usable size, so it should be made several months before you need hemodialysis. A good fistula can last for years and should not affect the way you use your arm. When you start hemodialysis, 2 needles will be inserted into the fistula. In one, the blood travels from the arm into the machine, and the clean blood travels from the machine back into the arm through the needle. You may find this a little painful, but you can have a local anaesthetic and you shouldn't feel the needles during dialysis. At the end of the treatment, the needles are removed and plasters applied. At first, specialist nurses will needle your fistula, but if you've chosen self-care hemodialysis, you will gradually be taught how to do this for yourself.
And for me, I'd needle entirely on my own. It's kind of second nature to me now. It was a big deal at first, and that was the thing I was most worried about. But actually, in reality, it's not that bad.
Occasionally, the fistula may not be ready in time for dialysis, and in this case, you may have a small tube, a dialysis line, inserted into a vein in your neck. This is a routine procedure and can usually be done without you needing to spend a night in hospital. There are a few people, however, who can only have a line. These are less reliable and can be prone to more infections.